Hi, my name is Todd Brankersmo. I am a student in Maryville University. Today, I will demonstrate a head-to-toe assessment on my friend Young. Whenever we do a head-to-toe assessment, we want to start with general inspection. General inspection is a quick way of assessing just patient's condition. Now, in his case, he doesn't have any kind of life-threatening problems, and he's actually instructed to be in the room. And prior to coming to his room, he was instructed to remove his clothes, put on gown, and also he was instructed to empty his bladder. To do physical assessment, we need some measurements, height, weight, and some vital sign. So we're going to demonstrate that real quick. Okay, good. He's actually weighing 132 pounds. Okay. He's 5'7½". And I'm going to take his blood pressure. Check pulse. Here's 115/75. And I'm going to take his temperature. 97.9. Check this. Okay. My current heart rate is 86, but this one's at 94, and I'm 74. His oxygen is 94%, so a little bit low, but okay. Now we're gonna start now the actual head-to-toe assessment. So whenever we do the head-to-toe assessment, we want to start from head all the way down to the toe, so that we won't miss anything. Now, first, I'm going to start with the head and face. I'm going to check the skin of the face, the color of the face or the skin, and check any kind of abnormality, compare, is it symmetrical, is there anything that I can see. Check for the external characteristics of the ears and eyes, are they symmetrical, is there any kind of variation between the two, which I don't see any. How about the, we check for the skull itself. Is it round? Is there any kind of abnormalities that I can see, deformity, which I don't see any? And then, while we're doing this, we can actually do some of the cranial nerve tests, which is I can have my patient to clench his teeth, okay? Can you wrinkle your forehead, puff out your cheeks, stick your tongue out? Good. So by doing this, he is actually, his cranial number 7 is intact, which is facial. Now, we're going to start palpating the patient. We're going to start with the hair first. check the texture of the hair. Is it evenly distributed? Is there anything like one side is more denser than the other? Check for palpate any kind of nodules or any kind of lumps or bumps or something that I can feel, which I don't feel any. And check for the facial bones. Any deformity or is there any pain? Do you have any pain? Okay. And gently palpate the temporomandibular joint. Have the patient to open his mouth, and close it. Okay. Is it closed pain? No. Good. Check for sinus regions. The frontal sinus, ethmoid sinus here, but we don't check normally, and sphenosinuses and maxillary sinuses. And you can percuss those. That cause pointing pain. All right. The next part is test for light sensation. So I'm gonna have my patient to close his eyes, and I'm gonna touch with cotton ball or something like lightly, and I'm gonna have him, the patient, to tell me if he can feel that touch. Just tell me now when you touch, okay?
No. 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 No.
Okay. So that means his cranial nerve 5, sensation part of cranial number 5, which is trigeminal, is intact. All right, next we're gonna move on to the eyes. And again, we're gonna start with inspection. Do I see anything abnormality? Are they symmetrical on both sides? Are they aligned properly? Is there anything that, something puffiness or anything that I see? Which, no, in this case. And palpate the upper lid and check for the eyelash and the hair distribution. And check for the sclera on both sides. Sclera should be white and free of debris. And check for the conjunctivitis. And should be pink and moist, which his is. And apply a little bit of pressure on the lacrimal apparatus, and that should not cause any kind of drainage or any kind of tearing, which it doesn't. The next thing is I'm going to test him for the near vision test, which is I'm going to have the Rosenbaum test, and I'm going to have him to read the smallest letter, that you can read. Cover one eye first, please, and left to right.
E, C, T, P, N, L.
Very good. And switch that, and the other way, right to left.
L, N, P, T, C, E.
Very good. So that means his vision coincides with 20/20 vision acuity. So the next one is I'm going to test him for a cover-uncover test. I'm going to have this board, and if you can just focus on one point and just cover and uncover, please. Good. Uncover, and try the other one. Okay, uncover. Okay. While he's doing this, I was watching what his people, reacting to. So his eyes not wandering or moving. So that's a good sign. Next thing is we're gonna move on to we're gonna check the actual papillary response, which I'm gonna shine light. I'm gonna check the pupil on both sides. Okay. Just focus on one point. Good. So what I see, the pupils are reacting to light consensually and directly, which is people require reacting to light and accommodation. The next thing is I'm gonna test him for using the ophthalmoscope, and I'm gonna check his the back of his eyes, the retina, the lens, all that, the fundus. So when I'm going to use right eye, the patient's right eye. Good. I'm checking the veins, the retina, and there is light reflex. And there is, lastly, I'm going to have him to see straight to the light to see for the macula densa. One more time, and look straight. Good. So his lenses are clear, not cloudy, which it should be that way. And I was able to check the macular density, which means it doesn't have any kind of, should not have veins in the macular density. Now we're going to test them for the 6 cardinal field of gazing, which is, I'm going to have my patient follow my finger, which is your upper left, far left, lower left, upper right, far right, lower right. Good. So my patient actually, he has the 6 cardinal field of gazing, which is his 3 cranial nerves are intact. These are cranial nerve 3, which is oculomotor, cranial nerve 4, trochlear, and cranial number 6 is abducens. Now, next we're going to move on to the ears. And again, check the ear for proper the alignment and placement of the ears. Do I see any abnormality? One side bigger than the other? With this case, no. So check the auricle, the back of the auricle. If you look up here, the auricle. I don't see any kind of lesion or anything. And you see it, yeah. And I want to check the back of the auricle here too, which he doesn't have any. So the next thing is I'm gonna test him for the whisper test, which I'm gonna have the patient to close one ear, and could you close one ear? And I'm gonna whisper the word, and I'm gonna ask him if he can hear it.
Orange.
Okay.
Apple.
Good. So that's actually a test for cranial nerve 8, which is acoustic or auditory nerve. And next, we're going to move on to checking the inner parts of his ears. All right. Hold the pinna downward, back and downward, and look the auditory canal. And check for, I'm checking for the tympanic membrane. So his tympanic membrane is not perforated, and it's not bulged or anything. I don't see any effusion. I don't see any kind of edematous or anything like that. And he's actually, I could actually see his bones, 3 bones, which is malleus, incus, stapes. Okay, this side too. And checking for even the hair distribution, the tympanic membrane, and the 3 bones, which I can see. There's actually red reflex right by the umbu. All right. Next, we're gonna move on to the nose. No, we're not gonna move. We're gonna test him for further testing. I'm gonna do the. There is another test called the Weber test and the Ryan test. The Weber test is I'm gonna strike the tuning fork, place it in the forehead, and I'm gonna ask him if one side, if he can hear one side better than the other, or both sides the same. Just tell me which side is better, or if you hear both sides the same, or one side better than the other.
Same.
Okay, on both sides, that's how it's supposed to be. That's a Weber test. The next one is Ryan test. Put the vibrating end of the fork on mastoid bone, and tell me when you no longer hear it, okay?
No.
Okay.
No.
Okay. That's actually the Ryan test, which is air conduction is longer than, actually twice longer than the bone conduction. Okay? Now, next we're going to move on to the nose. So again, start with inspection. Check for the structure of the nose and the position of septum. Is there anything abnormal that I see? Nothing. And then I'm going to move on to checking for the nostrils. And again, just gently hold here and look the inner part of the nose. So I'm checking for the turbinates, and I don't see any kind of drainage. All right. The mucosa is moist and no polyps or anything abnormal. So one more test with the nose is go ahead and patency. Check for patency. Like that. Very good. Very good. All right. Next, we're going to move on to the mouth and pharynx. And again, we're going to start with inspecting the mouth, the color of the mouth. Is there any kind of any lesion or any abnormalities that I can see here, which is nothing. I don't see any. We're going to move on to, we're going to inspect the gum, teeth, and all the interior part of the mouth. So we actually need to open and see the inner part of the upper, all the lips, and also it's better to use the tongue depressor to check for the buccal cavity. Okay, open mouth. And check for any kind of abnormality, discoloration. I'm checking for on both sides any discoloration, any lesion, and check for the gums, any gingivitis, and check for the teeth itself. If there's any kind of chips teeth or any kind of broken tooth or anything like that, and count the number of teeth too. Normal adult, most adult people has 32 teeth. And check for the tongue. Can you open? And the is it atrophied? Is it midline? And how about the color of the tongue? And can you lift that arm? And underneath the tongue, and there's nothing that I can see. How about to say ah?
Ah.
Okay, so checking the hard palate and soft palate too. So say ah again. Okay, so while he's doing this, I'm checking for the uvula. I'm checking for the tonsillary pillars and the back of the throat. If there is any kind of pustules or any kind of edema or anything or anything abnormal. So say that again. Ah. All right. All right. That was the test for gag reflex. So that's actually a test for cranial nerve 10, which is vagal. So we just tested two nerves, which is cranial nerve 9, glossopharyngeal, and the vagus nerve. All right. Next, we're gonna move on to the neck. All right. With the neck, again, inspect the neck. Check the symmetry of the neck, the smoothness of the neck, and the thyroid. And does he have any problem? Does he have any kind of swellings or thyroid or anything? Which I don't see any. And you want to touch the just to feel the alignment of the throat, or the check for the trachea. Sorry, trachea alignment. Check for the sternal notch here and kind of depress a little bit, and to see if there is any deviation or any kind of tracheal tag, which I don't see any. And test for the carotid pulse, one side at a time. Do not put both sides at the same time, so it won't clog the blood flow. All right, good. Next thing is you want to check for the thyroid too. One, kind of check this side, one side, and by pushing here, just palpate the thyroid. The best way to test that is have the patient drink, take a sip of water, and stay in the back and feel the thyroid Can you drink? Take a sip and swallow. Good. So the thyroid actually mobile freely without causing any kind of difficulty. Another test is we're gonna do for palpate for the lymph nodes. For the lymph nodes, we want to do systematically starting from the pre-auricular, post-auricular, occipital, segmental, submandibular, and tonsillar. And here, superficial cervical chain, post-cervical chain, and deep cervical chain. And one more here, supraclavicular area. Good. Next, we're going to auscultate. We're going to auscultate the carotid pulse with the Bailiff stethoscope. So I'm checking for any bruise, and I'm not hearing any bruise. And check for the thyroid for any bruise. Okay. And check for any kind of distension, like jugular vein distension, which I don't see any on him either. Next thing is, I want to ask him the active and passive range of motion, which is, I'm going to ask my patient to turn your head to the left, okay, right, left the other way, and back, and front. And I'm going to have him with resistance as well. Can you push? Is that? Forward? Forward. Okay, so that means pretty much everything is intact. Next, we're going to move on to the upper extremity. On upper extremity, I'm going to have my patient to extend his arm, and I'm going to check starting from his nail, fingernail. So, depress this, blanch it, and it comes back to normal, which is capillary refill less than 3 seconds. And feel the temperature, both sides, okay? And check for any kind of swelling, which I don't see any kind of abnormality, any lesion or anything. How about his arms, his shoulder, and I don't see any. So check for the pulse, radial pulse, and check for brachial pulse. Good. And the strengths. Okay, what is that? Okay, push me. Okay. Okay. How about shoulder? Okay, okay. All right. So he can perform all this. The shoulder shrug and the movement, and that's actually cranial nerve 11, which is spinal accessory. All right. Next, we're gonna move on to the back. Posterior chest and back. Right. I'm going to expose you a little bit here. And first, just inspect anything, the skin or the configuration of the chest. As a barrel chest, or is there anything that you have to worry about? That in his case, nothing. And then palpate for any kind of thing abnormal that you can feel, any mass or anything, which he doesn't have any. And check for tactile parameters. I'm going to ask my patient to say 99.
99. 99. 99. 99.
Good. Okay. Next, we're going to move on to the lungs. And again, when I'm here, I'm going to check starting at the back of my patient's chest. I'm going to assess for any kind of flared chest or any kind of abnormality, which is symmetrical, nothing that I can see abnormal. So I'm going to move on to percussing. We're going to percuss on both sides, starting from the right upper the scapular. Okay. Next, I'm going to do the chest expansion. Which what I'm going to do is I'm going to use both arm, kind of hold it here, if you can see this. Just kind of triangle, and I'm going to have my patient take a deep breath. Okay, there it out. Okay, one more time. Okay. So what I'm checking is both sides rising, inflating and deflating with the same amount. So one side is not bigger than the other. The other one is we're going to see the diaphragmatic excursion. So I'm going to start from the scapular and about mid-scapular, and I'm going to have the patient to take a deep breath and hold it. All right, take a deep breath and hold it. Think. All right. And breathe a little bit, and take a deep breath. Take a deep breath and let it out, all the way out, and hold it. Okay. So about here, from here to here, that's diaphragmatic excursion. So normally it's about 3 to 5 centimeters. So try on this side, same thing too. I'm gonna try the same thing. Okay, take a deep breath, hold it. Okay, so the chest side, the lung side should be resonate, and the solid area or organ side is gonna be dull. So I wait until the sound change, and then I'm gonna have my patient to breathe out and hold it again, and I'm gonna go up upward. Okay. Now. Okay. Okay. Take it. Let it out. Let it out. Okay. Now hold it. Think about here. So measure both sides, and that's the diaphragmatic excursion. All right. Very normal. All right. Next. I'm going to auscultate. I'm going to auscultate both sides systematically. All right, take a deep breath. Okay. So I'm checking the bronchovesicular and vesicular sounds, and he doesn't have any kind of wheezing or any kind of crackles or anything like that. So I haven't heard that. That's the posterior, and we're gonna do the lateral side too, comparing side to side. Okay? Can you just take a breath? Okay. We're gonna do this posterior, anterior lungs too, lungs. Take a deep breath. Okay. Okay. Yeah, breathe. No, breathe normal. Okay. All right. So next we're gonna do the chest the heart and the lungs, the anterior lungs. And again, we're going to start with inspection. Inspect if there is any kind of pulsation or heaving or anything abnormal, which I don't see any. And check for, palpate for any kind of lifting or anything. So checking systematically, like feeling the aortic region, pulmonic region, and tricuspid and mitral area. So I don't see any pulsation, or here I can actually feel a little bit, which is the Parsimon PMI site. And next, auscultate for the lung sound here and the heart sound as well. Okay. 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 Anterolateral chest. Okay. Okay. Now I'm going to test for the listen for the lung sound, the heart sound. So what I'm going to do is right on the right mid-clavicular line, the second rib, aortic region, which is aortic. Harmonic. Herbs. Tricuspid. And mitral. Alright, so here we also gonna check for tactile parameters here as well. So you're just gonna see 99.
99. 99. 99. 99.
Good. So checking on both sides the vibration, it's equal. Next thing we're gonna check is the node for axillary nodes. Just if you can just open it, just checking for if any kind of nodules or any kind of swellings, which doesn't have any. All right. Next, we're gonna move on to the abdomen. So if you can just go ahead and lie down here. All right. All right, and again, we're going to start with inspection. Do I see any kind of abnormality, any pulsing or anything, mass or anything that I can see here, which is it doesn't have any. And to make sure, just to check that, you can actually light, use light, pen light toward you, so just to see any kind of abnormality, which I don't see. Next, this is one of the tests that you actually auscultate first. So you want to auscultate on the 4 quadrants. So right upper quadrant, right lower quadrant, actually right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. So normally we have to listen for the abdominal stomach sound for 5 minutes, but for this reason we're not going to do that. Okay. Next, we want to auscultate for the arteries. We're going to start with the aortic arteries with the bed of stethoscope. So about left 8 ribs, I think, on a left side. That's for aortic. and I don't hear any kind of bruise. And renal, left renal, right renal, iliac, right iliac, left iliac, down here femoral, and right femoral. Okay, next we're gonna palpate. We're gonna start palpating the abdomen, the whole four quadrant. First, light palpation and deep palpation. We're gonna start this lightly, or you can just use one. And the same way that we did auscultation, and check for any kind of mass or any abnormality. Which, yeah. Okay. Any pain? No. Now, deep palpation is the same way. It's just a little bit pressure. All right. Next, check for the aortic pulsation. Normally, right midline here, kind of to the left side. And kind of, you can use 2 fingers and push it if you can see anything, which I do not see. All right. The next test is we're gonna move on to. All right. Oh yeah, the abdominal muscle. So the way to test that is just check the contour and everything, and then have the patient to raise leg, free raise leg, and if he can actually can hold that without causing any kind of pain, which he doesn't have any. Good, very good, very good. Sorry, press it up. Actually, no, please, I'm sorry. There's more thing to test here. We're gonna do the liver border. To check for the liver border is start about the 6th rib and percus downward. So here is gonna be resonate. The abdominal area is gonna be tympani. So first, just like check on both sides. Okay, good. And we're gonna start from here again. Sorry, it's a ticklish. What here? What here? Kind of, and we're gonna stop here, and we're gonna start from down here and all the way up. What here? So from here to here, that's lower side of liver border. The upper side of liver border. So normally it's about 6 to 12 centimeter. And for spleen on this side and percus, and different direction. Somewhere this area. All right. The next thing is checking for the liver by palpating. So what we do is we kind of push a little bit harder and check left side and to the side and push it upward and feel the edge of the liver. So kind of push it upward. Can you take a deep breath? Okay. So when we do that, it actually the diaphragm pushes the liver downward, so you can feel the edge. Sometimes you may not feel that. And for the spleen, the same thing. Kind of pull this side and push all the way and take a deep breath. Good. All right. Next, feeling for kidney. To check for the right kidney, the same way. You just have to press both sides. and taking a deep breath can help too. Good. And the other one on stand here and deep breath. Check 4. Good. Good. Very good. All right. Now you can sit up. Sorry. All right. So the next one is lower extremity, which is legs and feet and leg. So first, I'm gonna check the leg itself, the feet. Check for the temperature. Is it warm? Is it cold? Start with the capillary refill. And how about, is there any edema? Is there anything dipping edema? Just try that. And here too. Check the leg, compare, and the muscle strength. And check for pedal pulse. And check for posterior tibialis. Strong. You can compare both sides. And check for popliteal pulse. Okay. And to check the strength, can you just push up a little bit? Push up. I'm good. Good. And pull. Pull. And push. Good. Push. Okay. So everything is within normal limit. Okay. The next thing is we're going to do the more the reflexes. So we can use the reflex hammer, and the first thing we want to do is we want to start with the brachial. So kind of put like that and strike the brachial tendon. Okay. So normally what it does is the pronation, and which that is that we were able to see. And can you just sit back a little bit? Okay. So find the tendon. Okay, a little bit. Okay. And stroke here. Okay. And the Achilles tendon. So kind of hold this here. Yeah, kind of plantar flexion. Next, whatever that I haven't covered, the cranial nerves. I have already covered all the cranial nerves except one. That is cranial nerve 1, which is olfactory lobe, olfactory nerve. A test for that is having the patient smell something and identify what it is. So I'm going to have a patient to close his eyes and tell me what you are smelling. Can you smell it?
No.
I thought you can't smell anything. Okay. All right. So he was right. And how about this?
7.
Okay. All right. So that's he was actually identified. That was cinnamon as well. The next thing is we're gonna let me just revise the cranial nerves. Cranial nerve 1 is olfactory, which is the taste for smell. Cranial nerve 2 is optic, which is we tested with vision test. 3 oculomotor. 3, 4, and 6 oculomotor, trochlea, and abducens, which are checking for the movement with the eye movement. Cranial nerve 5 is trigeminal. Cranial nerve 7 is facial. Cranial nerve 8 is acoustic. Cranial nerve 9 is glossopharyngeal. Cranial nerve 10 is vagus. Cranial nerve 11 is accessory, shoulder accessory. Spinal accessory, I'm sorry. Cranial nerve 12 is hypoglossal, which is the atrophy, the movement of the tongue and everything. So we test all the cranial nerve, the 12 cranial nerves. The next thing I'm going to do is I'm going to have my patient to stand here. And so starting from the spine, check all the way if there's any deformity, anything that I can see. And so no deformity or the lumbar region, and I don't see any. So just by symmetrical and everything, I don't see any kind of bulginess or anything. So can you bend over and touch a little bit? Okay, good. So we can do that. So at this point, I have concluded my head-to-toe assessment. I hope you enjoy it, and thank you very much.